Okay, so I really appreciate you giving me the opportunity to kind of show you line flow. We've been around since 2014. My name is Matt Quinn, and I'm the Chief Revenue Officer of the company. We started working with physical therapy companies who were trying to communicate with patients between the PT and the patients. And we kind of grew that to about 200 practices. And about 2 years ago, a Dr. Kurt Hoffman, who's an orthodontist in the Kansas City area, came to our CEO and said, you really need to repurpose this for dental because we think this is an outstanding product that you guys should really kind of bring to not only orthodontists, but GPs and other specialties. So I'm going to show you what the platform looks like. What it is we are a remote communication platform that allows the patient and the practice to do remote monitoring. They're allowed to do live virtual calls. They're allowed to utilize it for marketing purposes because we can white label the app and create it specifically for the practice. And then we can also use it for recall. So I'm going to go ahead and share my screen with you so you can take a look at what we're doing.
Absolutely.
And so let me pull in here 1 second. Let me know when you can see my screen.
Yep, we are seeing your screen right now.
Okay, so this is live data. This is all HIPAA compliant. This is a small subset of one of our practices. And these are actual patients that are utilizing this for remote monitoring for aligners. So what you see on the left here is you'll see patients and they're ranked in orders by color. And we have actually patented a compliant scorecard, which I'll show you shortly, that will make the patient move up and down in order based on how compliant they are. And this is extremely helpful for the doctors because they don't need to worry about the people that have high scores. They need to worry about the people that are having lower scores that are not being compliant. So what you see here is you have, oh, excuse me. Still see my screen?
Yep.
Okay. So what you have here is patients on the left-hand side. What you're seeing here is the number of hours that a typical patient wears the aligner per day, what aligner they're on. And then on the right-hand side, you see communication going back and forth between the practice and the patient. So I'm going to jump into one of the patients here so you can kind of see a little bit closer. So Jaro started the process. He came into the practice and said, hey, I'm a busy person. I don't want to come in every 6 weeks. I wanted to do all this remotely. Do you have an option for remote? And the doctor said, yes. So he started on October 15th of 2020. He's using Invisalign. We can use any manufacturer, so it doesn't matter what manufacturer of aligner it is. Here's all the staff that is assigned to Jaro that can actually communicate back and forth with him. He was given 23 aligners. He's supposed to change his aligners every 10 days. He's on current aligner 17, and he should be done on April 19th of 2022. So the first thing you see here is there's a green button that says start virtual visit. At any time, the practice or Jaro can actually request a live virtual call. It goes right to Jaro's phone, and they can do a live virtual call, or Jaro or the practice can text back saying, hey, can we schedule it at a different time? The next tab you see here is the actual treatment MPH score, which is proprietary to us. This is his scorecard based on answers that he's telling the practice. He's a 91 out of 100, which is very, very good. So every day he's going in and answering how many hours he wore the aligners, how he thinks the bite feels between a 1 and 10, how he thinks the teeth look between a 1 and 10, and how he thinks the treatment is going between a 1 and 10. And that'll update his score every time he answers these questions. You can see that he missed some days, which will impact his scorecard. So he's not 100% compliant, but he's doing pretty good. So we typically tell people that any score above 80 is pretty good. They're doing a pretty good job. But below 80, you either want to do a live virtual call or you want to bring them back into the practice. Next tab here is prescription. The doctor wants him to do daily check-ins. And then the doctor also wants him to change the aligners every 10 days. And then also, this is the content that was pushed out to Jaro, how to take pictures with your current aligner, no aligner, and new aligner. And I'll show that to you what that looks like in the patient message thread. Here are the resources that were pushed out to Jaro, and we know he read them. Aligner instructions and care, Invisalign use and care instructions, and cleaning tips. The date and time stamp, and then we know that he read them, so he is aware. And then here's his patient message thread. Here's the communication going back and forth between Jaro and the practice. Pictures that he's uploaded, we can zoom in on to take a look at. And we always ask for new aligner, no aligner, current aligner. And then you can see all throughout time, all the pictures that Jaro has submitted. He can do a video as well. It's not just static pictures. So he can do both. And we can push out any content back and forth. And then the next tab is the clinical message tab, which is specifically between people at the practice. And we do have treatment intelligence in here, so it will notify the practice when something has occurred, like he changed his aligners or he's overdue on aligners. So this is kind of like our version of intelligence, so the practice doesn't have to continue to bother Jaro. It automatically notifies the practice when an action has been taken, and date and time stamps that as well. And then here, the last tab in here is we have a progress tab of all pictures all throughout time that he's uploaded. And what he's doing is he's taking a simple cheek retractor and standing in front of the mirror and doing a picture with his smartphone. And these pictures obviously are pretty good quality, so there's no attachments or anything needed to be done for that.
Did you say he used, I'm sorry, Matt,
Yeah.
did you say he uses his regular phone?
Correct.
Okay.
Correct. Yeah, these are high quality images used with his regular smartphone. And so that kind of shows the dashboard, but I want to show you what the app looks like, because the doctors prefer to use an app sitting chairside, and they want to be mobile. They don't want to be tied to a like a iPad or a screen. So they use their own phone and they have their own app. And I'm going to show that to you here real quick, because it allows the doctor to be a lot more allows them to be a lot more mobile, and they can answer questions and do things, at their home or however they want to do it. So can you see the phone?
Yep.
Okay, so here I'm going to show you the Align Flow Essentials app. This is the doctor app. The doctor can be sitting chairside right with Jaro. It's a scaled down version of what you just saw on the dashboard. So here's Jaro. Again, I can go right into his pictures. I can see what his score is. I can actually see a history of all his pictures. And I want to do a selection here. I'm going to select a couple, excuse me, I can zoom in when I'm sitting there with the patient and talk to them about how things are progressing. But I'm going to do like an earlier picture compared to one that's most current. So I can do a compare and contrast. So I can do side by side right on the phone, sitting with the patient, zoom in on how the teeth are moving to show the patient, and doctor can actually just do this all on his phone. So doctor can actually change the prescription too. At any time, it'll give a push notification to the patient, letting them know that, hey, your prescription's changed. Doctor can look at all the previous messages. He can hit the start virtual visit. It'll notify Jaro that he wants to do a live virtual call right through the app.
Yeah.
Then we also have all of the, doctor can look at, change the prescription. They can look at all the pictures. They can see the treatment MPH score. They can text right from the phone like their normal texting, or they can do the live virtual call. So doctor can really be a lot more efficient, with their time. And they only look at the ones that are more of a a problem. Like, so notice that Ryan here, his color has changed. So doctor's probably going to want to look to see what's going on with him. And first thing he's going to look at is what is his treatment MPH score? Well, he
Mhm.
clearly is not doing very well. He's not being very compliant. So doctor's probably going to say, hey, what's going on here? Text him or do a live virtual call saying, you're not being compliant here. I don't want to have to do a refinement. So I'm a little concerned why you're not following the protocol here. So that's kind of a quick down and dirty of the doctor, but I want to show you the patient app too.
Mm.
Patient never pays a dime for this. This is all free to the patient. This is not live data. This is not from a practice. So this just has fake data in it. So I just wanted to let you know that. But
Mhm.
you can see right off the bat, I'm overdue for changing my aligners. I need to go in and take the pictures and upload the pictures. So I got to go into the mirror, put my retractor in, take the picture and upload them. And I got to
Oh.
do those 3 sets of pictures.
Uh,
So then after I do that, I got to do my daily check-in. I need to answer these questions. And then these can all be customized. These aren't standard. We can customize this any way you'd like.
yeah.
So how many hours you worn the aligners? 21. How do you think the bite feels? It's a 10. My teeth are looking great and getting straighter, a 9. How is the treatment going smoothly? 10. I send the report and it's going to update my compliance scorecard.
Mm.
So this is all about efficiency and making it a better workflow for the practice, but it's also about allowing the patient to have the flexibility not to have to keep coming in, every 6 weeks. They can come in every, like every 16 weeks or whatever the doctor decides is most efficient.
Mhm.
And the way we do everything, it's on a subscription model. So there's no contract. Everything we do with the practice is based on how many logins they're going to need and how many active patients are on the platform. So if a
Mhm.
practice wants 4 logins up to 100 active patients, it's a $249 a month. If they want 10 logins and 250 active patients, it's $399. And then 25 logins up to 700 active patients is $699 a month. And then
Mhm.
we have a one-time onboarding for an hour and a half with a practice to show them, train their staff on it. But then we also customize all the templates because they can use this for teeth whitening, TMJ, sleep apnea, aligners. It's not just limited to aligners. And the thing that we like to show a practice is how is this going to impact their practice from a financial standpoint?
Mhm.
Let's say that they currently only have five aligner patients per month. If they take it
Mhm.
up to 20 aligner patients per month, they have a staff of 3. They currently have patients coming in every 6 weeks. They're going to push it out to seeing them every 18 weeks because they can do everything remotely. They've just saved the practice 58 hours of chair time and increased their profitability by over $24,000.
Yeah.
And that's net of our fees. So that's not our fees are nothing compared to the savings they get by using this product.
Mhm.
What do you think?
Excellent. That's pretty good. Do you have any similar demonstration for other like you mentioned about physician therapy, physical therapist,
Yeah,
and
we do. Yeah, so our parent company is called In Hand Health, which is for the PT side.
mm,
The platform is very similar, but the difference is that on the PT side, they're basically doing either live video calls or they're pushing exercise content out to the patient and using PDFs or videos or things like that. So the patient can do all the exercises at home or do a live virtual call with the physical therapist at the right through their phone. So, and then we can customize those questions that the PT wants to ask based on what care group they're in. So like here we can set up different care groups. I mean, we have different libraries and resources. This is very much more focused on aligners, but
okay.
we can basically put any content we want in here. It's in a library that can be pushed. We can customize it. Resources, same thing. The templates, what kind of templates you want to put in there. And then also,
this
go ahead.
could be good for the cell ligated practice, like demon practice, where orthodontists they only see patient maybe once every 3 months. So that's something that they can use it too.
Yeah. And the thing is that's really cool about this is that, once a patient finishes their treatment plan, they actually stay on the platform. So that way you can still keep communicating with them. So for instance, if Jaro, once he finishes his aligners, you still have access to his phone. So you can push content to Jaro saying, hey, you should use our teeth whitening, or hey, remember we talked that we had some challenges with sleep apnea. We can help you with sleep apneas too. So you can keep communicating with the patient and not just have to sit there and call them or email them, and you can also schedule future appointments, whatever you need to do, all right through the app.
Can you go back to the price, inquiries price again?
Yes.
One more time. Yeah.
Yeah, let me get back on there. So what I'll do is the pricing here. So we have a silver package for smaller practices, four clinical users, 100 active patients, $249 a month. For 10 clinical users, 250 active patients, $399 a month. And for 25 clinical users, 700 active patients, $699 a month. No contract, it's month to month. And then we do a one-time onboarding. It's about an hour and a half session for $699. We train all the people in the practice, and we customize all the templates based on what treatment templates they want to have or what they offer in the practice.
A couple questions. Let's say if somehow the doctor is no longer interested to use it, can he or she get the document back, like the conversation between them and the patient?
That's
the picture.
Well, it is your data, yes, because it's all HIPAA compliant. So it is your information. So yeah, you would have that access to that. But I think, I'm not sure, we could probably send it in a different format. But yeah, it's your information, and it's your communication between you and your patient. We're just the communication platform.
Maybe this is something that could be applied for just any doctor office should have one of the way to keep a record, which you using the online record. This is almost like telecommunication.
This is we're not integrated with the practice management software or anything like that. We can, but this is really communication between the patient and the practice, because the patient prefers to do this. As you know, with the direct-to-consumer model, you've seen a plethora of these companies trying to do this, but the reality of the matter is that the doctor needs to do the treatment plan. They're the one that needs to monitor this and stay on top of it, not a third party. So we've created this to really allow the practice to offer a remote platform, but still handle all the treatment plan. So it's a win-win. The doctor can communicate. They actually have better relationships with the patient because they have access to their phone now, and vice versa. And then obviously patients love it, and they refer more patients because they don't want to come in. It's nothing personal against a doctor, but if you're just coming in for a 15-minute checkup on your aligners, it's a waste of time.
So yeah, I understand, but what I'm saying is like this is in the future, maybe this is something that you probably can use it for patient communication with just any other kind of practice, just
there's teledentistry type companies out there. That's all they do is it's live virtual calls. We're
Mhm.
adding more bells and whistles because, you know, not only can we do live virtual calls, but we can have a compliance scorecard. We can text, we can do video, we can do, we can do like recall on, with patients once they complete a treatment plan. You can use this for a multitude of things. It's not just a one-trick pony.
Right. When you send a message to the patient, would it be notified on their app only or on their phone as well?
Well, it'll show on their, it'll on the app, it'll give like, see how this is like the red mark here?
Yeah.
There's a message here that has not been viewed. So it'll show on both on the app as well as the dashboard, and then it'll also show on the patient's side as well if they've read it or not. So if I come into here, they've not responded. Like Becky has some messages. Now Becky works at the practice, and she sent this to him because Becky asked him, Aiden, you're doing great. I need you to really work on your upper aligner. Use the rubber chewy to bite the upper aligner into place on the fourth front tooth. Bite down on the chewy and stay biting down on it. And then she sent a picture example of it of what she's concerned about.
Mhm.
So he hasn't responded to that yet. So that's it'll notify his phone saying, hey, you need to respond. She sent this message on the 7th of February, and he's yet to respond yet.
Mhm. Well, very interesting, Matt. It's a really good information. And some of the demo that you show would be okay to use it
Absolutely.
publicly?
Yes,
Yes.
please
Okay.
do. The more the merrier. We're trying to educate people and give them opportunities to grow their business, because this has a huge impact on workflow and profitability. And the bottom line is that patients are continuing to demand this and they want it. And we've actually, I wanted to show something to you very quickly here, because this really kind of shows what what we were able to do from a practice standpoint as far as having an impact. Because this is, we've been like collecting data and watching what's happening at a practice over a period of time, and the numbers are pretty staggering about how well a practice can do based on when they fully incorporate this into their business. So I'm going to show this to you real quick because I think this will be interesting to you.
Sure.
So this is an actual practice. Oops. Hold on one second here. Trying to get that. Trying to show you this slide from this. Okay. Here we go. Okay. So this is an actual practice. In 2019, they had 38 hours a week of open. They dropped it down to 30 in 2021. They had 5 aligner starts per month. Now they're up to 11.25 per month because they're offering remote monitoring. Their revenue increased 14% in 2020. Their profit increased 78% in 2020. And then in 2021, their profit or their revenue increased 34.5% and profit increased 92%. Here's the real kicker here. The treatment plan close rate went up from 58% to 75%. And that's all due to the convenience that this offers a patient. They like it and they prefer to do it versus coming in.
Wow, that's excellent. That's wonderful. The case in point to show people. I really appreciate. How do people get to communicate with you guys?
Yeah, our website is alignflow.com, and you can request a demo right from our website. It's www.alignflow.com, all one word.
All right. Is there a phone number?
You can call me at 913-827-1603.
All right. Matt, thank you for your time.
Thank
Really
you.
appreciate it. We're going to post this on my channel.
Okay, I will send this to you, and I appreciate it. And if you have some interest, we can talk further offline, and I'll follow up with you.
All right. Thank you very much.
Thank
Thank you
you.
for your time. Have a
Thank
good